Viktor Frankl is not usually listed among the founding figures of cognitive behavioral therapy or acceptance and commitment therapy. Those histories tend to emphasize different names: Aaron Beck and Albert Ellis for CBT, Stephen Hayes for ACT. But if you read Frankl's work carefully, particularly the techniques he developed in the 1940s and 1950s, you encounter the intellectual ancestors of ideas that these later therapies would formalize, systematize, and test empirically. The connection is not accidental. Several of the key figures in the development of CBT and ACT were familiar with Frankl's work, and the overlap between logotherapy and these approaches is too extensive to be coincidental. Consider paradoxical intention, Frankl's technique of instructing anxious patients to wish for or even mock the very symptom they fear. A patient with a fear of blushing is encouraged to try to blush as intensely as possible. A person with insomnia is instructed to try to stay awake. The mechanism, as Frankl explained it, involves breaking the feedback loop between anticipatory anxiety and the symptom it provokes. When the patient takes a deliberate stance toward the symptom rather than fleeing from it, the symptom's grip weakens. This is structurally identical to what CBT calls exposure techniques and what ACT calls diffusion, the practice of observing a thought or sensation rather than being fused with it, of taking a metastance toward one's own experience. Frankl was doing this clinically decades before these frameworks existed. The language was different. The philosophical grounding was different. But the practical mechanism was the same. Then there is dereflection, Frankl's technique of redirecting hyper-focused attention away from the self and toward meaningful engagement with the world. The over-self-monitored patient, the person who cannot stop scrutinizing their own experience, is helped to shift focus outward. This prefigures what CBT calls attentional training and what ACT calls committed action, the practice of engaging with life according to one's values rather than waiting for internal states to change. ACT's framework of psychological flexibility draws heavily on ideas that are thoroughly Franklian. The willingness to experience difficult thoughts and feelings without being controlled by them, what ACT calls acceptance, resonates with Frankl's concept of attitudinal values, the idea that one's stance toward unavoidable suffering is itself a form of meaning. The orientation toward values as the compass for behavior, ACT's central therapeutic move, is logotherapy translated into behavioral terms. What does logotherapy offer that CBT and ACT sometimes underemphasize? The most significant difference is philosophical depth. Frankl's approach is grounded in an explicit theory of what a human being is and what a human being ultimately needs. The existential and spiritual dimensions of human life are not peripheral concerns in logotherapy. They are central to the diagnostic and therapeutic framework. The question of meaning is not one intervention among many. It is the lens through which everything is understood. CBT and ACT, developed within a predominantly scientific behavioral paradigm, have largely bracketed the philosophical questions in favor of empirically testable techniques. This is partly a strength. It allowed these approaches to accumulate the evidence base that logotherapy never systematically pursued. But it is also a limitation. A therapy that does not ask what the patient ultimately lives for may miss the very dimension of their suffering that is most in need of attention. Frankl's legacy in contemporary therapy is therefore somewhat paradoxical, influential but often unacknowledged, absorbed into frameworks that preserve the techniques while sometimes leaving behind the philosophy. For practitioners and patients who sense that something deeper is called for, that the question is not just how to feel better but why to go on, returning to Frankl's original formulations remains richly rewarding. Subscribe to The Psychology of Viktor Frankl to explore more of his timeless ideas.